Hi, Arisha. Can you hear me?
Hello?
Hi, can you hear us?
Hi, yes, I can.
Okay, thank you. Hi, Misty. Can you hear us?
Hi. Yeah, I can hear you.
Awesome, thank you.
Yeah, thank you.
Hi, Jessica. Thank you for joining. Can you hear me?
I can. Hi.
Thank you. Hi, Ashley. Thank you for joining. Can you hear me?
Yes, I can hear you. Can you hear me?
I can. Thank you.
Thank you.
Hi, Liz. Thank you for joining. Can you hear us?
Yes, I can. Thank you.
Thank you. Darren Balaam,
Present.
Charlene Bybee,
Here.
Ashley Daftery,
Here.
Jessica Goicoechea-Paris,
Here.
Leanne McCauley will be absent today. Arisha,
Here.
Jorge Montano Figueroa,
Present.
Sarah Porter, Natalie Sanchez.
Here.
Paige Samples. Chris Smith.
Here.
Misty Von Allen.
Present.
And Annie Zucker.
Present.
You have quorum.
Excelente. All right. Well, with that, let's move on to item 1.03, the Pledge of Allegiance, which Peg has agreed to lead us in. Thank you. So with that, we'll move on to item 2.01, which is the approval of minutes for October 14th, 2024, Safe and Healthy Schools Commission meeting. This is for an action item. Is there any public comment on this item before we vote, Sylvia?
No public comment.
Great. So I'm looking for a motion to approve those minutes.
Darren Balaam, motion to approve the minutes as proposed.
Thank you, Sheriff Balaam. Is there a second?
Annie Zucker, second.
Thank you, Vice Chair Zucker. With that, all those in favor, please signify by saying aye. Aye. Aye.
Aye.
Aye.
Any opposed? And any abstained? Great. With that, the motion passes. And on to item 2.02. This will be presented by Tammy Zimmerman. And this is a presentation on the status of the school district's single point of entry projects and possible action to recommend to the Board of Trustees to move forward with implementing the projects at additional school sites to be determined. So this is a presentation and for possible action.
Thank you. For the record, Tammy Zimmerman, Chief Facilities Management Officer, here to present what we've done last year based off of your recommendations. Do we have a clicker? I'll do. Okay, next one. So the history, all the elementaries have a single point and secure perimeter. The middle schools do as well. Proctor Hug, as we know, was built with a single point and secure perimeter. Incline High School received one as part of their donations from the Duffield Foundation. So that is completed as of this point. And last year, this commission recommended to the board the single point and secure perimeters as pilot programs for McQueen, Sparks High School, and Damani Ranch. Damani Ranch was finished pretty close to the beginning of the school year and has been in function since then. Sparks High School and McQueen High School had a substantial completion as of last Wednesday. So they're in, they have nice glass in the windows and are functioning. So that, I wrote that back in October, so. Reed High School will receive one through their modernization plans, which we're looking for funding approval in February from the board, and will begin construction in June of 2025. Next slide. So just to give you guys a little bit of a background of what we look for in the high school single points, and that we have CCTV cameras, we have secure office windows so that the people are secure behind them. They have a transaction tray in most of them that they can get through. I say most of them because Damani Ranch is a little different because it's just the front door because their office is so far back. And until we do the modernization for those, that was our interim solution, was to do the front door vestibule. They have a camera where they ring the doorbell and a camera where they can see in the front office who it is, and they can let them in and watch them actually walk down that long hallway to that front office for them. So McQueen is going to be very similar to what we do for Reed, and it is, if you've ever been into McQueen, they have the front vestibule and there's the front doors, and that blocks you off from getting into that hallway where the sophomores and freshmen have their locker rooms or lockers. And then to one side, you have your front office and the bookkeeper vestibules with secure glazing and a transaction tray for them. And so Reed will be very similar to that when we get through that in the modernization. The exterior improvements, we worked with the school and school police to determine where that fencing would go in gates and how they had to administer that to not let them back on those fields, because we want the students to be able to go and have PE and get in and out without going outside the secure perimeter. So that's what you'll see in the majority of these single points and secure perimeter projects. Next slide. So you guys also in October of 2023, which seems like a long time ago, gave us approval to go and recommendation to the board to go and put in security film. So that security film is, it obscures the vision into the front, so you can't see students in passing at the front doors or in the lunchrooms and that kind of situation. So you recommended it, and we completed it for the beginning of this school year in those 33 schools. So we'll look at producing more of those as we move through into the other schools through their facility modernization plan. Next slide. So what I'm here today to ask is for some recommendation to be forwarded to the board for the prioritization of the remaining high school single points. These schools don't have a single point currently. Academy of Arts, Career and Technology has one, but it's not up to the standard that we'd like. Turning Point has one, but we'd like to improve it. But Reno High School, Worcester, North Valley, Spanish Springs, Galena don't have a single point or a secure perimeter. So we're asking to prioritize those today. We've worked with school police as well as the Office of Teaching, Learning, and Leading to prioritize these schools in this order based off of their needs and the safety that we see and need at those schools. So with that, I'm just asking for approval to move forward in this fashion with these high school single points and secure perimeters.
I see some questions. Go ahead, Commissioner Bybee.
Thank you. So Tammy, on the secure filming on those doors, I get you don't want people looking in where they could have a vision of people there. If you're inside, can you see out?
Yes, you can see out. You can see who's outside.
Okay.
They just can't see in the other way. We call it a 70-30 perforation, so you can see somebody outside.
That's what I was hoping.
Yes, you would be able to not open the door if there was somebody out there that you did not want to be around.
That was the answer I was hoping for. And then as you prioritized the schools in what order, kind of give me a little better idea how you determined, is it incidents at those schools? Is it, higher risk there? Obviously, some are easier to do than others. And way back when we started this, we knew like Galena would be really hard and Worcester because of the layout of the schools. So the actual physical architecture of those schools we knew would be a bigger challenge. So kind of what were your top things you looked at in order to prioritize what order you would do them in?
So we did not prioritize them from a construction aspect. We prioritized them based off a school police recommendation and the Office of Teaching, Learning, and Leading. So in that, it's more about the incidents and the areas and the activities that they would like to keep out of their schools and out of their property.
Vice Chair?
Tammy, hi. Is there a communication plan or an education plan for parents, staff, for the community about these?
So when we start designing these, we do work with the school to actually talk about how it would function and have them at the school community reach out to their parents and students to educate them on when it's going to be done, what the expectation is, what you could see when you come, especially for the first day of school.
Do you know if those have been executed?
At the 3 schools that we've done for the pilot program, they have been done, yes. And we do work with student voice at the schools to kind of get their input as to how the schools function. They eat lunch certain places, how we could work around that and make it still, nice for the students to see and to use, right?
Will there be signage for visitors about what the expectation is on the campus, that this is a closed campus and this is how you would check in? Like, is there a buzzer when you get there and nobody's at the front? And then if those doors are locked, what those next steps are?
It has signs. They do have signs on the front door. That buzzer, when it buzzes, specifically at Damani Ranch, it goes to 3 different people's desks. So the idea is that there's enough people around in the front office to answer that door. And it has certain hours on the front door that says we're here from 7 until 4 p.m.
And then, sorry, one more question. After hours, you just brought up. So after hours, how do those operate? Like the fencing, all of that kind of stuff, like for school activities and stuff like that after school?
So after school, the idea is that those fencings are open, right? You can get access in. We do, per one of our admin regs, we allow access to our facilities for outside use. So those gates are supposed to be unlocked and able to have access by the community. But during school, they would be locked down.
Is there a question online, Sylvia?
I don't see any. Do any of you have any questions online?
think I see a hand. Yep. Arisha, please.
Right, I have a quick question. So I know a lot of people. Wait, can you hear me?
Yeah.
Yeah. Okay. So I know a lot of our students at Galuna, they go out during lunch. We're off campus. So how does that work when they try to come back into the school? Do they have like a set like way to scan their card and like open the door?
No, so if you have off campus in the morning or off campus in the middle of the day and have to come back, you would have to go through the front door just like any other visitor to check in.
Okay.
So with that said, McQueen being an off-campus lunch opportunity, how do they all go through the front door?
Well, I take that back for lunch. For lunch, the staff helps to administer those side doors into the student parking lot to allow them in. And then once they're in at lunch, they shut the doors.
Got it. Commissioner Smith?
Thank you very much. Good afternoon. Tammy, quick question about following on the theme of the comms plan. How about outside agencies that'll be supporting the school during the school day or after hours? Are they part of that as well?
Part of the discussion and the communication with how it's designed. So we have not engaged. We have not engaged outside responders. We work with the school police. We do have Knox-box keys, right, that allow, and emergency door numbering systems on our schools that allow those responders to respond.
Okay, thank you.
Tammy, I'm curious because one of our public comments last meeting was from a gentleman, Mr. Mann, and his child went to McQueen. If somebody has questions, a parent has concerns, is it best to just have them reach out to your office? Because he had questions regarding the single point entry and feeling like it wasn't quite as safe as maybe he had hoped. He said
Certainly. We have, through our capital funding and our capital projects, we have a webpage.
Okay.
Or, I'm sorry, an email
Yeah.
that they can email to, and then I get those emails and I can respond to him. And in fact, I think we did respond to him specifically about this. He was questioning the secure perimeter and when that would be completed.
Perfect. Thank you.
Quick question. In regards to validating whoever it is at that point of entry, what kind of information do they need to provide? Name, ID, anything of the sort, or what does that process look like?
So that is done by our emergency management, Mr. Roy Anderson. And he does, what we have is Raptor, where they have their ID and it scans the ID to see if they can be let in.
Including, let's say that's a parent?
Even
it's
as a parent, if you
or
want to come in past the front door, you have to be checked in through that system.
Sheriff Phelan. I was just going to do a motion. Oh, great. I think Commissioner Bybee has a question.
I have one more question, then I'll let you make a motion. Okay. So Tabby, tell me how we just did pilots at Sparks High, Damani, and McQueen. How did the pilots go? Were there things? Because I know the high schools all along, when we started elementary, was pretty easy. Middle school a little tougher. We knew high school was going to be more of a challenge. So what have you learned with the pilots, and are you making any adjustments to what we're doing? I know every school's different, but what have we learned or gained with the pilot schools that we just finished?
Well, all of those schools that we did the pilot programs at, the students were actually asking for them. Single point secure perimeters. So it's not a surprise. It is a little bit of an angst getting there on time and getting through, if you're late to go in the front door. So I think that's one of the biggest learnings that the students have had, is to actually be to school on time. Otherwise, you got to go through the front door. At lunchtime, I think it is an administration that has to be able to monitor those doors and let those students in at lunchtime if they choose to have an open campus. The other one is, and is always kind of in the back of our mind, is students propping doors open, or even adults propping doors open. But that's something that we just have to teach them. It's for their safety. And I think that's part of the administration's work at those schools.
Okay, and just to follow up to that, on the doors being propped open, are we enforcing the policy of classroom doors being locked during class to prevent if someone does get into the school, that we've got locked doors and they can't access the classroom?
That is something that Roy Anderson, the emergency management officer, does drills with the staff to tell them that those doors need to remain locked at all times while they're in class and in school.
Any other comments or questions for Tammy? Okay, seeing none. Sylvia, is there any public comment on this item before we move to a motion?
No public comment.
Okay. Commissioner Balen?
Hey, I make a motion to do the recommendation for the following high schools to take to the Board of Regents? Trustees, to finish the single point access entries.
Just a point of clarification. I think Tammy was looking for a prioritization, or just were you listing all of the schools?
So we were listing them in priority order in that list. So
And so is that what your motion entails, that list to?
As listed from priority. How's that?
Thank you.
Beautiful.
welcome.
Is there a second?
Yes, I would second.
Thank you, Commissioner Samples. All those in favor, please, please say aye.
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 Any opposed? Great, motion passes. Thank you so much, Tammy. With that, we move on to item 2.03, which is for presentation and discussion only. This is an update on the progress to date for the school district's proposal related to the state opioid crisis grant and proposed revisions to policy 5250, alcohol, tobacco, and controlled substances, student prevention, intervention, and related opioid usage and e-cigarettes. And this will be presented by Catherine Loudon and Eric Olson.
Thank you very much, Commissioner Sanchez and members of the Commission. So for the record, my name is Catherine Loudon. Our presentation today will begin with the information about the grant that we applied for in October, which came to us through the Substance Abuse and Mental Health Services Administration and the state of Nevada as a part of opiate response funds. My colleague, Eric Olson, I wanted to make sure that I introduced him to you because though many of you have worked with him in your agencies and organizations over the years, we have been lucky enough to have him for over 10 years as a project coordinator for Project Prevent, or the Peace Grant, which helped to address the issues of violence and introduce school social workers through the North Valleys community. And then after that, and we now have him as the Project Aware coordinator, and Project Aware is in conjunction with the state of Nevada, again, to build capacity around mental health and improve training related to mental health. So our district has been looking at the issue of student opiate use for quite some time. We have some concerns about what we have seen, and most all of your agencies have heard from either law enforcement or hospitals or juvenile justice or through nonprofits like the Cabinet and Human Services and the community about opiates. So Eric and I are going to just kind of move forward. Go ahead.
Good afternoon, members of the Commission. Thank you for the opportunity to meet with you today and share some information about this grant proposal. So we included some consequence and consumption data just to help kind of set the context behind the reason for applying for this type of grant. First, we included some data from a public health snapshot from UNR School of Public Health. And this is really all overdose deaths during a period of time. It's really just meant to punctuate the fact that we do have a significant problem with overdose deaths. And unfortunately, fentanyl is a pretty significant component of those overdose deaths. Fortunately, that's not super common at the adolescent stage, but it's obviously a cause for concern. Included a little bit of data about our middle schools and what we're seeing from our youth risk behavior survey, really with regards to current prescription pain medication misuse. We could see with our middle schoolers that rose from 3.4 to 5.8% between 2021 and 2023. I would point out that may look like a low number, But when you think about it, that's really looking at 1 in 20 of our middle school students having some experience misusing prescription painkillers. So that's kind of one of those early indicators of concern. We also looked at data from our Infinite Campus data documentation. What we saw from the last school year is 609 students at our middle school and high school levels that had documented incidents regarding substance possession or misuse at school. So just to give you a perspective on how many students are going through procedures within the school about discipline, counseling, support. Of those students, 14% of those students had more than one incident. So one of the things that we really prioritize with this grant is how to reduce repeated occurrences of substance misuse. Next slide, please.
Eric, can you define, can you go back? You have secondary and you have middle school. So is secondary students?
So secondary includes middle and high school.
Okay, thank you.
All right, this might be a little bit hard to read, but we just wanted to put a little bit more data from our youth risk behavior survey. This is at our high school level, and this is from 2021 to 2023. We could see a slight increase in alcohol use. So this is really current alcohol use. Alcohol use remains our number one substance when we're looking at adolescent substance misuse. Our marijuana use at the high school level has increased slightly. Some people may perceive that our marijuana use rates are higher, still lower than our alcohol rates. When we look at non-medical prescription painkillers, we can see a slight decrease at the high school level, and we'll talk about middle school in a minute. And then vaping THC products, there was some increase at the high school level. Part of why I think this slide is significant is that you can see from here that the vast majority of our high school students are not currently misusing substances. I think there's a common misperception that the vast majority of students are using, and that's just sort of normal for our teenagers. This helps reinforce that that isn't the norm. Next slide, please.
Eric, can you tell us where those averages, where that falls under the national average?
So I don't have that data with me. We could certainly come back or get further information to you.
Thank you.
Yeah. Just trying not to drown you with data for today. At our middle school level, as you would probably expect, it is lower than at our high school level. But what I think we see here with our middle school data in the same categories is a little bit more of an increase. With the grant proposal that we submitted, we really prioritized middle school and early high school for that very reason, trying to do more around early intervention. Next slide, please.
Okay, so currently, one of the things that we have available for our students is our substance misuse intervention program. And this is a program that we've had in place in Washoe County School District for many years. And so Eric mentioned those 609 students and the 183 student referrals to the substance abuse program. The substance abuse intervention program takes place at Wooster High School. It's for secondary students, so middle school and high school students. They attend 4 separate in-person classes, and they are able to attend if their parent attends with them. So this is something that definitely is a choice and an option for our schools, but you can see from the data that because this program requires a parent, if you don't have a parent that can attend with you, that could become a barrier. Also, our district is very large. I heard someone once describe it as the geographical area the size of the state of Connecticut. So we only have one site for the substance abuse intervention program. And so because it's 4 classes, because it's in person, we often don't have full completion rates. And you can see we have partial attendance, or they attend part way through the program, and it doesn't provide our students with everything that they need. Now, fortunately, we do have other resources available. For example, we've now added mental health professionals to many of our high schools, or school social workers to many of our high schools, so that our students can participate in the program. And then through the pandemic, in collaboration with Join Together Northern Nevada, we were able to make a virtual option available for some students. Again, it's a psychoeducational option, which we often see students participate in if they have an NIAA or athletic violation and they want to get back involved in sports. They would participate in that. They take a quiz, and then after the quiz, the results come back to us in our office in counseling and social work, and we can help them with compliance. But we were able to see something that we have known for a while, which is that the substance abuse program really isn't enough for everything that we need to do. And we know that often when we're working with students who are having substance misuse issues, it takes multiple points of intervention and collaboration and work with parents rather than a single psychoeducational course. So although we have seen some families benefit from the program, we saw that there was a concern that needed to be addressed. So along came the state opiate response program opportunity, and this grant could not have been more timely for us because as a district, not only through our collaboration with different agencies are we hearing people talk more and more about the opiate overdoses and issues with youth substance, but also, we as a community are trying to collaborate on how to better serve our students overall. And so this grant that we were able to apply for again in October, we haven't received the answer about whether or not we received the funding, but we were able to apply for it in October. It's through the state of Nevada, the Department of Health and Human Services, and then the Substance Abuse and Mental Health Services Administration. So we're waiting. Eric collaborates often on the SURGE, which is the Attorney General's Substance Use Working Response Group, and I have been listening and following along with the ACRN, which is the Advisory Community for Resilient Nevada opportunity. And so we're hoping we could receive this. We, as a district, have a funding cliff. So the opportunity to continue to address substance misuse, is challenged due to the funding cliff. There were many different things that we could apply for in this program, but after we looked at that data and had conversations with our partners, we decided to apply with the state opiate response grant in the area of prevention and initial intervention that Eric described to you before. We added to the grant, we applied for approximately $300,000 per year for a coordinator and a school social worker, and then also working with some contractors to try to make sure that our sites and their capacity was built to address substance misuse.
So what is it we actually propose to do if we're awarded the grant funding? Really, we're looking for a site-based option to kind of strengthen the range of interventions that we have, not just have a centralized Worcester High School intervention. We also wanted something that's personalized, that's really customized and looking at the unique needs of the students and the families that are participating. So we really looked for a screening, brief intervention, and referral to treatment model, which some of you are probably familiar with. I'll talk a little bit more about this. What the intent of the grant is for the grant staff to work with some early adopting middle schools and high schools to lead this intervention with them, and over the course of the grant, gradually transition the leadership of the intervention to the sites so that hopefully this could be sustainable long term. So the first part is really implementing screening, brief intervention, referral to treatment. The second part is a professional development component. This is really to propose and hopefully get approved a district class for staff that really deals with substance misuse prevention theory, looks at screening, brief intervention, and referral to treatment models, looks at something we call motivational interviewing, which is a key component of screening and brief intervention and referral to treatment. So it's really coupling those two components. Next slide, please. So the vehicle that we've proposed within the district is something that's called Teen Intervene. If anyone wants some light bedtime reading, I can loan this to you. Teen Intervene is an evidence-based structure to do the screening, brief intervention, and referral to treatment when it's needed. So Teen Intervene includes 3 student sessions and 1 family session. Really starts with a screening component. Something that's known as the CRAFT would be a screening tool that we would use, which really looks both at substance misuse patterns, but it also looks at risky behaviors and context related to substance misuse. So it starts with screening, and then through the first session, you're really getting at the motivational interviewing component to this, which is how do you work with a student to kind of increase their readiness, their willingness, their interest to pursue change within their own life, kind of from the understanding that if they're not planning to change and they're not interested in change, it's a lot harder for us to intervene. Really, it looks at things like decision-making skills, who's in a youth social support network, kind of promoting some positive changes along those lines. There is 1 family session where we're really looking to both help the parents understand the goals of the program, but also to strengthen some family communication patterns. Hopefully, as youth are increasing their readiness to make changes, then the family support would kind of go hand in hand with that. For some of the youth, we anticipate that they probably do need a higher level of intervention. So as needed, there would be a referral to treatment component that would be working with our community partners to set up referral networks and patterns that will hopefully be very user-friendly for families to access additional services.
And I just want to follow up on the description of the OPIT grant to let you as a commission know that plans and support for implementation of SBIRT has been something that, as a screening, something that we have wanted to do and worked on for quite some time. We just have not been able to have an avenue to have it implemented. And Teen Intervene is not brand new to Washoe County School District. It's something that we were able to pilot in other settings before. So it is not something that is brand new, and we're looking forward to being able to have that kind of hybrid CRAFT, if you're familiar with CRAFT, as a behavioral health provider. And we feel like this will be a way to bridge and provide better support for our students if we're able to obtain this grant.
Catherine, when you all piloted it before, how did that go?
Do you want to answer?
So when we piloted it before, it was with a community partner working with one of our high schools. So it was a little bit different in that we weren't actually leading the intervention. So the information that we have is more anecdotal, but very supportive of the intervention. We would just like to not be dependent on an outside provider or using grant funding to do this.
Thank you. Yeah, so it's always better if we get to run something and then we can build capacity and spread it. So next I want to talk to you a little bit about the recommendations that you brought forward for us to take a look at our board policy, which our current substance misuse board policy is 5250. And we took a look at it as it relates to e-cigarettes and vaping, because that was the direction that you gave back to us. And this board policy was written specifically to address prevention, intervention, and aftercare as essential components. And as it stands, it has a lot in place for what we as a district are doing with substance misuse. It addresses vaping in general. We also have some administrative regulations that also look at substance misuse. So Administration Regulation 1332, which is alcohol, tobacco, and controlled substances prohibited in drug-free communities and workplaces. The issue that we found, though, is because our schools are looking to pilot vape detectors, and for example, McQueen just recently had theirs installed because they're going to be one of the schools that has vape detectors in their building. This policies, and these policies that we have in place don't address vape detectors. So we would need a separate vape detector policy. We couldn't cover under any of these policies or regulations as a district what would happen with vape detectors. So currently ACT and McQueen are the main schools that are kind of moving forward with this. And from what I hear from McQueen specifically, there are costs involved and there are other things that they're putting in place related to the vape detector. But in order for us to have a comprehensive plan, which we have discussed would include things, and your commission discussed in the past, would include things like not just a standalone vape detectors in schools, but other things that went with that in prevention. So in general, our recommendation after having key stakeholders review it, and that included some of the members from Join Together Northern Nevada's multidisciplinary task force, as well as those who are substance misuse specialists in our office and some behavioral health specialists. We believe that these policies that we currently have as a district and regulations cover many things, but not vape detectors, and we would need something separate. So I don't know if you have questions about that.
Are there any questions?
Just regarding the vape detectors, there's other schools that have privately funded their vape detectors so that they don't have any coverage in a policy then? Or there's no policy about the ones that they installed with private funding?
So for the record, there oftentimes we don't have a separate policy for several different things that are implemented. We just currently, in examining our substance policies and drug-free workplace policies, don't have something specific to vape detectors. And in order to have something comprehensive, so another example would be like when we implemented drug testing with athletes. McQueen was a leader in that too. Well, we had to have something special to address that. And McQueen, even though they found private funding, and it's approximately $4,000 per detector to have it implemented in their schools, the actual what it's going to look like related to consistent and equitable treatment of students, we haven't, as a district, put that in place.
Other questions? Commissioner Bybee?
I've got several. I guess on following up with Annie's vape detectors, I've got a question down here. Consequences, is that part of policy? I guess in our current policies that we have, and with the vape, with kids that are vaping or alcohol or drugs or any of that, we already have set up consequences and what the penalties are, and that's part of your education and awareness to hope you move towards prevention. If kids know, if we're found with it, this is what will happen versus nothing would happen. Is that true?
Yes, correct. So we already have existing policies for e-cigarettes and vapings and what happens if someone has a vape device on campus and what happens if they're found vaping and all of that. So that is not changing.
Okay.
What we wanted to do was put something in place related to policy that would encompass things like, let me give you an example, consistency from site to site if they have a vape detectors. So because we have a couple different high schools that are going to have vape detectors, what is the parameters around what kinds of vape detectors would they have? How many would they need to have? What places would they put them? So some facility type consistency that would be separate and apart from discipline. I think from the administrator's perspective, what they share is that it's to be a deterrent. So it's something that provides them a deterrent for things like vaping in the restroom. So smoke detectors would detect smoke, but they don't detect vape. So they want another detector in the school. And then what we had said is to try to address the prevention and the support that goes with it if you're going to use a device like a vape detector. And there's really more involved in that too. So for example, Governor Lombardo has their safety task force, and they talk about things like how do you dispose of vapes that you collect, and that's something else that goes with it. So just in reviewing the policy, there really is a few things that need to be added, which lead us as a department to believe that it might be a good idea for the district to have something that's more specific related to vaping and vape detectors.
Okay, I appreciate that. And then backing up real quick, I had a couple questions on the teen intervene. How are kids chosen? How many students? And what happens after the grant? Because I know when we get grants in the city, we have to be careful what we're using them for, because once the grant is up, where do you have the budget to cover that cost? So those would be the three things.
So I would say first we would need to approach our secondary disciplinary administrators and really make them aware of this opportunity. So I would anticipate that some schools might be quicker to respond or say we would like to start offering this. The grant would not allow us to implement district-wide with any students. So there would definitely be some prioritization. So that would be some of the readiness factors at a particular site level, because our hope would be, as I mentioned, we would want to implement it with the assistance of the site staff to train them to implement it in the future. So
and they're referring the students, I guess. How did the students?
So the students would initially present through the disciplinary process. They would be in trouble at the school. Okay. When the administrative team is meeting with a family, they would propose this is an option. Some families would elect it. Some families would probably decline the opportunity. So there would be a selection from the family too.
Okay. And then with the grant that you've applied for, you said $300,000 a year. How many students do you hope to reach with that grant money?
So it's hard to give you a specific number because, as we've kind of shared with the data, we have upwards of 600 students that could technically participate. I don't think we would hit 600 students. The student access would be relatively simple. But we would only have one social worker working in conjunction with the site. So that would be the limiting factor, is how many students they could reach in any given week. The harder part would be the family component. When we would actually meet with the families, when we could get families to either come, would that need to be outside of the contract day? So that's going to be the harder piece of this to predict, is what would allow that to work most effectively.
And I'll just add on to that. So the one social worker and the grant coordinator would be working with the site behavioral health staff that our district has put in place. So our school social workers and mental health professionals in our high schools currently would then be collaborating and working, and with our counseling and psychology staff as well.
Other questions from the commission? I'm looking online. See anyone? Anything else in person? Okay. Well, thank you for that presentation. We've got a question.
Sorry.
Commissioner Smith.
Yep. Thank you.
Yeah.
Catherine, a quick question about the vape detectors and the recommendation there. So it feels like to me this is one of those areas that if the district makes the policy about vape detectors, then feels like we're going to open the door to installing vape detectors across the board. So is that the intention? And then is there a possible funding stream for that to the schools that don't have vape detectors?
Hi, Chris. Commissioner Smith. Actually, no, it would be more of a way to provide support for those who currently had it or found the funding to implement it. We don't currently have a funding stream in place for vape detectors, but for our schools to implement them and put them in place, the district has to have that guidance and that consistency. So that's why we made that recommendation. Otherwise, the implementation of the vape detectors could vary from site to site, and that's something in general our trustees and our commission are not in favor of.
Just a comment on that. I think about a year and a half ago, we kind of had this experience that somebody had come to us as a vendor, and that is why this has come. So I think it's really great that we've taken action on addressing that. If we are going to have vendors or have schools that are privately funding or those kind of things, that equitably that we're using the same processes and procedures to be able to implement. So I think I feel like I remember this conversation about a year and a half ago, and I think it's great that we're going to be doing that, because there's going to be more schools that do want it and could probably fund it. But to say this is how we do it and give those guidelines and really set them up for success that way is great.
I would agree that it's a great thing. And I'll advocate for those schools that may not be able to afford it and ultimately have to find that funding stream to apply the same criticality of support services in their schools. And just because they don't have the operating budget or the funding streams to do it doesn't mean that the school district ultimately can't find a way to do that. But that's for down the road for sure.
Well said. Thank you. All right. Oh, I have one more. Okay, great.
Yeah, this is Ashley Daftery for the record. One, I just want to thank both of you for all the incredible work that you're doing. I think as these comments about vaping have been coming up, and even having some policy throughout the district on it, I'm wondering if that would include also policies related to data collection. So even though the aim of the vape detectors is maybe to deter, but does it actually impact students' use and support students in quitting? And if not, are we really getting to the aim there? So that's just a thought in terms of as you're thinking about creating policies, might that include collecting data related to that? Because then I also wonder what happens to the students and what is the impact. So after, if there is an incident, if vape usage is detected, are we really getting to the goal at supporting student positive outcomes, their engagement, their family engagement with the school?
Thank you for that. Yes, absolutely. I think that would be really important to determine whether or not it was a useful tool to begin with.
All right. Well, thank you, Catherine and Eric. This has been a big thing on this commission, is talking about the e-cigarettes and the vaping and wondering what we can do. So thank you for coming together with this, and I'm fingers crossed for the grant. Thank you. We'll move on to item 2.04, discussion and possible action to determine topics for the safety forum short videos, including but not limited to, I'm going to read some of them: e-cigarette use, fentanyl, suicide prevention, the need for student connections and to build a sense of belongingness among students, homelessness, mental health stigma, inclusion, and safe routes to schools.
Thank you, Chair Sanchez, members of the commission. For the record, Paula Marca, Chief Student Family Supports Officer. I'm up here mostly just to introduce to you Andy, our new liaison through the communications department, Andy Casaneri. Did I say that right? I said it right. And she'll be assisting us. And so during your last discussion, if I have it right, I think you passed the minutes and I think it's in there. You opted to move away from the more traditional safety forum that you've done in lieu of a couple of, or several, small short videos. And so what Chairman Sanchez just read is just a list of topics to kind of get your juices going and your conversation moving. Those are based on things you've done in the past and some of the current issues, but you shouldn't feel limited to that. I do think we're meeting less frequently than we have, And so time's going to get away from us. So if you do choose some topics, you might want to think about what's your real objective, who's going to build content, who might do some of the delivery, and then we can support you throughout. So I'm going to be quiet, and maybe Andy will talk a little bit and respond to your questions.
If I could just add, well, I appreciate Paul asking you guys to think about those additional things. Right now on the agenda is just the topic selection. And then once you select the topics, maybe our next agenda could be picking people and how to implement those topics.
Or debatably, you couldn't finalize the topic unless you had thought through some of those things. But I defer to legal counsel.
I always defer to legal counsel. I want to open it up to the commission about thoughts on those topics and moving forward with this. Oh, yes, online, please. I think Commissioner Flores.
Thank you. This is Commissioner Flores for the record, and thank you very much, Dr. LaMarca, for introducing this. All of those topics, of course, I look through things, look at these topics through the lens of the work in juvenile justice, and they absolutely all overlay. I do, in preparation for this, I did want to see what, according to the CDC, were the most prevailing lethal issues that our youth are facing, and they continue to be unintentional accidents, most of which are related to traffic safety and accidental firearm discharges, homicide, unfortunately, suicide, and the lethality of the firearm overlays with those topics as well, with suicide and homicide. In our community, we see all of these things. And so I would just like to make a recommendation that we consider traffic safety and firearm safety along with the topics that were already listed, and would be willing to assist or take lead on any of those subjects. I will add that recently we have a juvenile traffic court here at Juvenile Services, and the Nevada Traffic Safety Commission awarded our program of the year because of the work that we do in traffic safety. And so I just wanted to add that as a little promotion. And one last note is that in light of the idea that we had to move some options online, a question would be if we're limited in any way to the number of topics that we can pursue, provided we have people willing to produce these educational submissions. Thank you.
Andy, is there a sense of that about how many we could potentially do?
I think just because of the resources available, I imagine there would be. I think, I know I've talked with my supervisor, but I think we're looking at maybe 4.
Okay.
One per quarter, something like that. Might be a starting point. We can always go back and just, and discuss it and stuff, but we do have, the resources on our team that we have to take into consideration.
Okay. And so if we did do something like 4 videos at a time, since they are online, they could live online, and then each year the commission could decide to add to that.
Oh, yeah.
Okay,
especially
great.
if they're made evergreen, and, they can live for years, absolutely.
Great.
Yeah, build.
I think those are excellent ideas too, Commissioner Flores, particularly the traffic and firearm safety. I remember that presentation we had that I thought that was really impactful, and it seemed like parents really enjoyed that too. So I see people put their video cameras on, so this makes me excited that there's a lot of conversation around this. Commissioner Porter.
Hi, Commissioner Porter for the record. I was just wondering, I totally agree with what Commissioner Flores said in terms of traffic safety. And I noticed on Paul's list that we had safe routes to school. I feel like those are related, of course. And I, as a parent in the district, that is one of the biggest things that I get in communication from my kids' schools is safe drop-off, safe pickup, safe crossing. I mean, it seems to be something that is a constant issue for the administrators at this school and keeping those kids safe just for drop-off and pickup. And it seems that no matter how many, emails of don't go this way, this is one way, drop off here, don't turn left, it doesn't seem to resonate because I keep getting the same messages, and I know that the administration is also pretty frustrated with this because it's a safety risk for kids. So I think that there's enough chatter around that. Parents hear it enough. Kids are probably concerned about it if they're walking to school, getting dropped off, etc. And the fact that Safe Routes to School, we do already have that partnership there. And as Commissioner Flores said around traffic, I think that I would agree that that should probably be one of the priority videos that we do.
Great. Thank you, Commissioner Porter. Go ahead, Commissioner Bybee.
I agree with those that we've said. I mean, there's so many. Trying to pick four is hard. But as we build on this, I think doing the videos, and to your point, they're there and can be accessed at any time and maybe updated because things change. I think like right now for me, mental health and suicide. And I know we've got Misty here, who is our champion expert on suicide prevention. And we've just had 2 recent suicides, young kids in this community. And there have been so many in the last few years, younger and younger, and I don't know what we're not doing, but we're not doing what we need to be doing. And we need to, and I know there's not a silver bullet. I know Carrie with Forever 14, there's other families who've been impacted that are trying to truly educate. And I don't know if there's other best practices, some of you that are all experts in the field. But what are we doing, or what are we missing? What do we need to do better, especially on youth suicide? Because it's just a tragedy that rips families apart, rips communities apart, and it's mental health. So mental health kind of creates a whole lot, but I'm really most concerned about suicide.
So Commissioner Bybee, last meeting, were you at the last meeting? Oh. This commission made a recommendation to the board around youth suicide prevention training. So, which I would love to get an update on where we are in that progress, but I know that that's not this. Correct.
Okay. Perfect. Thank you. You're welcome. I think, go ahead. Go ahead, Dr.
I didn't hear what Member Bybee just said in response to Ms. Zucker.
Actual training. That it's actual recommendation to the board for training more above what a video that we're producing as part of our safety forum. Is it bigger than that? It's training staff, families,
it's bigger
students.
than
that. What do you look at? Or it hasn't happened yet. So is it yet to be seen what the Board of Trustees decides to do?
I don't really have a vote, but I would say I wouldn't take suicide prevention off of your short list.
Yeah, I wouldn't take it off. And before we get too in the weeds on that, because I see Sarah, because that one's not on the agenda, so I think we probably better close that and go to Commissioner Allen, and your thoughts on it. Yeah.
Thank you, Chair Sanchez. Excuse me. We would be very pleased to provide English and Spanish videos for the Safety Forum. We have a wonderful new training in Spanish that's been supported by several of the members here. And I think that's been a gap we haven't been able to do in the past. And to Commissioner Bybee's concerns, absolutely, it is the ongoing challenge of trying to get the right people in the room. So this Safety Forum is one of our options to engage with parents. That's been our challenge. We do have Project Stay, which Annie Zucker is a big originator and supporter of, which focuses on sports teams, associations, coaching staffs, and extracurricular. Adults working with kids, that will be growing in the next several years throughout the state, but especially in Washoe County.
For the record, this is Jorge Montano from Renowned Health Injury Prevention. I want to touch back on the comment from Commissioner Flores in regards to firearms. As you mentioned in preparation of this meeting, looking at the mortality rate of young individuals, you absolutely are correct. Firearms are the leading cause of death for children across America. I believe, if I'm not mistaken, it's 1 to 24. And if we put that into context, in 2020, you look at the graph, and firearms have surpassed motor vehicle crashes as the number one killer of children across America. And if we think about the exposure to those two mechanisms, that's very alarming. This is something as a organization, Renowned Children's Hospital and Safe Kids Washoe County, which I help facilitate both of those, are prioritizing and raising awareness, because I think that's where it starts, that conversation. And I think through the school district, we have very unique access to parents, and that topic should be around secure storage. Because as we look at this specific topic, no child should have unsupervised access to a firearm. So I think we start with that. In whatever form that looks like. I would love to help facilitate with you, Commissioner Flores, but I think that's a topic that we really need to bring to our parents. We owe it to them in regards to awareness, educating on best practices around secure storage, and then what are the available resources in our community? Because I think this really ties in to mental health as well, as Misty will kind of has that conversation. Firearms are uniquely lethal when it comes to any suicidal attempts, so individuals in crisis. And then it really just flows into opioid and fentanyl and that whole triad I really believe in. And unfortunately, this, when I started looking at it 2 years ago, was this concept of, well, that's occurring not necessarily in our local Washoe County, or this is an East Coast problem, but from the data that I've seen at Renowned Children's Hospital, being the only trauma center in the region, those number of firearm injuries have significantly increased. I can't confirm the total numbers for 2024 quite yet because our data is not finalized, but I would be prepared to share that with you come February once our data is finalized. But it is a going on issue subjectively that we've seen in the hospital of treating kids with firearm injuries. And this is in three methods: violent, self-inflicted, and accidental shootings. So it's something we really need to take into consideration, and this would be a great way to do so via this forum.
Thank you, Commissioner Montano. Are there other thoughts from the commission? So it sounds like so far, just to recap, we are looking towards traffic and firearm safety. We are talking about suicide prevention, and it sounds like, and it looks like, as the mental health representative on this panel, along with Jessica Gokachia, that these topics all fall really into a discussion of mental health, and resources and referrals could be given back to Catherine's department and other outside referrals as well. So I think mental health can be the basis of any of these other topics that we pick as well. Other thoughts? I think we have, so that's 2 topics. Three, traffic. Are there strong thoughts or feelings about a 4th topic? I would suggest, and just put it out there for discussion, the vaping e-cigarettes, simply because that's been something that the board has asked us to look at and something that's been important. So I'd suggest that's worth at least us talking about. Yeah.
And on the e-cigarettes, I think we lump that together with our fentanyl and opioid and what we've talked about of what you're doing with the grant. But I think that all falls in one category together of, abuse from vaping to fentanyl and the fallouts from that. So I see those together.
Great.
Would that be something we would be able to do, to lump in the opioids and fentanyl with e-cigarettes and vaping?
I think it would depend, which is not agenda-sized, who would be having that discussion, but perhaps based on the presentation we just had, that those things have a natural marriage with each other, and someone in the district would be able to do that. This is just hypothesizing.
I think you're okay if we're limiting to 4, to make sure that those could be connecting into one topic. So I think we're okay on the agenda, but I appreciate you making sure we're staying on within the scope.
Oh, great. And then there's someone online, Commissioner Flores.
Thank you, Commissioner Flores, for the record. Because I didn't want to list too many topics when I first spoke, the one I was not commenting on is the one that was just mentioned. So I would be in support of that
Great. Commissioner Montano, did you have something to say?
Yeah, I think as we prioritize those three in regards to safety, I think the fourth that would be I would say a positive uplifting that is also connected to this would be this student connections and that sense of belongingness. I think if we could improve that specific aspect of it, I think it would help us with the other three. So that would be my vote or my suggestion in regards to including there instead of, you know, three safety and then this uplifting, what can you do when empowerment of parents and student connectiveness. So.
Okay, great. So I think we have 5 on the table then.
And I want to, with 5 excluding the connection or the joint effort of opioids and vaping, or is that
No, with
independent?
included.
Okay.
Yep. So with that, does someone want to, are there any thoughts on the 4, making a motion with 4 of them, and we'll see if it sticks. Yes. So yeah, just to go through. So we have That's okay. We have traffic. We have traffic safety, and which would include safe routes to school. We have firearm safety. We have a conglomeration of the e-cigarette use with fentanyl and opioids. And then we have suicide prevention and mental health. And in addition to the student connection and building a sense of belongingness. Yes, Andy, please.
Can I add I don't know if I'm supposed to or not, but as far as the uplifting and belonging, that can be a through line built into all of them. So my humble suggestion would be that's something I could build in and we could write in to the other 4 topics because it's important in every aspect. So
wonderful.
Can we motion?
I think first let's check for public comment. Sylvia, is there any public comment?
No public comment.
Great.
So I will motion to have the 4 topics be traffic safety, including the safe routes to schools, the vaping and drug misuse prevention as a topic, firearm safety, and suicide prevention and mental health, with the theme threaded through of safety and belonging for all 4 of those.
Oh, I think you did it.
That was tough.
That was good. Is there a second? Oh, wait, Sarah?
Can I just clarify when you were talking about the second topic, which was the vaping and then the drug use, that would include the fentanyl and opioids with that?
Correct.
Okay.
And I'm not saying it again. So correct is correct.
This is Murphy Allen. I'll second that motion.
Outstanding. All those in favor, please say aye.
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 Any opposed? Great. Motion passes. Great job. And now let's move on to item 3.01. This is time for public comment. Thank you, Andy and Dr. Lamarca, by the way. Thanks for getting us all together on the same page. Is there any public comment, Sylvia?
We do have public comment from Haley Seats.
Great. Thank you for joining us, Haley. It's right up here. You get to stand. Yeah.
Alrighty. Good afternoon, everyone. My name is Haley Seitz, and I attend Proctor R. Hug High School, graduating class of 2025. Today, I am here to express my concerns of why our students deserve a longer lunch period, especially since at Hug, our periods have recently been extended. As students, we face a demanding schedule filled with back-to-back classes, assignments, and extracurricular activities. The constant pressure can really take a toll on students' mental health, making it essential for us to take time to decompress during the school day decompress during the school day. Sorry. Mental health is a term that gets thrown around these days, often without a full understanding of its true significance, especially in the lives of teenagers. During our teenage years, we face a whirlwind of changes and challenges, from academic pressures and social dynamics to personal identity struggles and future uncertainties. The stress can be overwhelming without proper attention to mental health. These pressures can lead to serious issues such as anxiety, depression, and even suicidal thoughts. Studies have shown that taking breaks, especially longer lunch breaks, can significantly reduce stress and anxiety levels in students. When we have more time to relax, socialize with friends, and enjoy a meal without rushing, we return to our classes feeling refreshed and more focused. This not only improves our mood, but also enhances our ability to learn and to retain more information. Additionally, having a longer lunch break encourages healthier eating habits in teens. When we have enough time to eat, students are more likely to make nutritious choices other than opting for fast food or just skipping the meal altogether. This break is not just a privilege, but a vital part of maintaining our mental well-being. It offers us the chance to step back from our academic responsibilities, engage in activities that bring us joy, and connect with friends who can provide us emotional support. If the HUG schedule will allow, I believe that a 40 to 45-minute lunch will be more beneficial for future graduating classes. With that being said, extending our lunch period is not just a matter of convenience, but it is a necessity for our mental and physical well-being. By giving us the time to decompress, engage in physical activity, and make healthier food choices, we can create a more balanced and productive school environment. I hope you can take into careful consideration prioritizing our mental health and advocating for longer lunch breaks we deserve. Thank you.
Haley, thank you. And it looks like we have one more public comment.
Brisa Hernandez Flores.
Welcome.
Hello, good afternoon. Okay. Good afternoon, members of the Washoe County School District. My name is Brisa Hernandez. I'm a student from Hug High School, and this is my final for my American Government class by Mr. Dinosaur. And I'm gonna give out my speech in Spanish since it's my first language and I feel more comfortable speaking Spanish.
Por favor.
Hoy quisiera hablar de la alimentación que recibimos los estudiantes día a día en las escuelas. Pues en mi opinión personal no es la mejor comida ni la más saludable por todos los factores que tienen en su tabla nutricional. Otro problema es que todos los días recibimos la misma comida, like pizza, chicken popcorn, cheeseburgers, chicken sandwich and salad. Los estudiantes estamos cansados de todos los días recibir la misma comida, que aparte no es para nada saludable. La comida que recibimos hace más difícil mi vida y la de los estudiantes, pues que los alimentos no sean saludables por sus niveles de grasas, calorías, en sí, todos sus factores, aparte de tener que comer lo mismo día con día, lo hace más difícil, causando obesidad y mal estomacal en los estudiantes, pues no todas las personas vivimos en las mismas condiciones para poder tener comida en nuestras casas o salir a comprar, porque obviamente pudiéramos comer en nuestras casas o ir a comprar comida, pero no todos tenemos los mismos recursos para ir, por eso tenemos practice y lunch en la escuela. Y una solución sería tener mejor calidad de la comida, es decir, más saludable en todos los aspectos, y variedad. Es decir, como un día nos den una cosa, otro día otra, y se pudiera ir repitiendo en sí lo mismo, pero no todos los días exactamente lo mismo. Y sería mucho mejor para todos y ayudaría a que los estudiantes coman mejor y por lo tanto tengan un mejor desempeño en aprendizaje, porque si nos alimentamos mejor, obviamente tendremos mejor capacidad para aprender. Pondríamos más atención, tal vez pudiéramos dormir mejor porque estamos alimentándonos bien y todo eso. Entonces pienso que eso sería lo mejor para nosotros. Si ustedes nos pudieran ayudar con eso, sería un muy gran favor. Any questions?
Muchas gracias, Risa.
Thank you for your time.
Thank you. With that, we will adjourn this meeting at 3:15. Our next meeting is February 3rd, 2025.
Thank you, Chair.
Thank you.
Thank you.